Hi class, Dr. Jim here. Chapter 21. We are to the last of the bacterial units. This time we're going to be looking at the spirochetes and the irregularly shaped bacteria. So these guys are primarily the guys that tend to look a little bit different than their normal bacillus or cocci. Again, we're going to look at the spiral bacteria or the spirillum, which includes things like syphilis, which is treponema, and then we're also going to be looking at the bacteria that causes Lyme disease, which is Borrelia burgdorferi. Then we'll take a little bit of time looking at Vibrio, which is kind of a bent rod. It's kind of a hook rod on there. We'll also look at Campylobacter and Helicobacter, and those are two that are, again, intestinal parasites. One is an intestinal, the other one is a stomach parasite. And you may have heard of Helicobacter, especially if you've ever suffered from an ulcer or you know someone that suffered from an ulcer. We see that there's a direct correlation with a Helicobacter infection and having ulcers. So we'll talk a little bit about that today. Then finally, we're going to finish up for all you dental hygienists out there that are taking this class and looking at a little bit about mouth bacteria and dental health and what it all means, and kind of putting it together of why it is important that we take care of our teeth and what happens in those situations. So we're going to take a little bit of time looking at that and looking at mouth health and associated with the bacteria as well that grows in there. Okay, so that's where we're going to begin today. So let's take a look at our objectives. And the first one are, what are the spirochetes, and what ones are considered the serious human pathogens. And again, I've mentioned those two already. The first one is the one that causes syphilis, and then the second one is the Borrelia, which is the Borrelia burgdorferi, which causes Lyme disease. So we'll look at those two today. The second thing we're going to look at are the three curviform bacteria that are considered human pathogens. And again, the three that we're going to take some time and look at is the one that causes cholera, another which is Vibrio, and then we're going to look at Campylobacter, which causes a lot of times some discomfort with some gastrointestinal distress, and then finally Helicobacter, which is one that is actually an infection of the stomach, and we'll look at that as well. And then we'll talk quickly about some that are unique morphology, one of them being Rickettsia. It causes Rocky Mountain spotted fever, which is another tick-borne disease. And then finally, we'll spend the rest of the time looking at the dental diseases and which groups of bacteria lead to dental disease. And we've already talked a little bit about those. Primarily, it's the strep verdans group that we discussed early on with the strep or the gram-positive cocci. We'll look at that again and talk a little bit more about what dental disease is and how that affects the overall health of the patient as well. And so that will play a huge role, especially you guys going into dental hygiene and even in nursing, because we do see some effects from bad mouth care that can lead to overall repercussions in overall health. And so we'll discuss that as well. Okay, so that's what we're looking at today. All right, so let's spend a little bit of time on the spirochetes. Now, this is a very large spirochete, and you can see it has many, many spirals or corkscrews in it. This would be an example of probably treponema, very long spirals in that case, and it has a very long rod that's kind of spiral, or the spirochetes. Okay, and again, the difference between spirillum and spirochetes is not necessarily the shape, because they're both corkscrew shaped. The spirochetes have a little bit more of that periplasmic flagella. We briefly talked about that. That's the flagella that's actually inside the bacteria, and we looked at that in chapter 4 when we discussed flagella. And so that's kind of what separates the spirochetes from spirillum. But if you just think of spirals or corkscrews, I'm perfectly happy with that, and that's what we'll look at right now. Okay, so a couple of the groups that are in these categories. So the spirochetes, again, are gram-negative human pathogens, and again, most of them are free-living saprobes living off of dead things. Some are commensals of animals, but not many are pathogens. The two that we're going to look at today are Treponema, which is the one that causes syphilis, and then Borrelia, which is the one that causes Lyme disease. So those are the two that we'll look at. And again, this kind of gives you an idea of the shape, and you can see it has the flagellum on the inside, so it has that periplasmic flagellum on the inside that helps it kind of twist or corkscrew around, and it gives that very corkscrew or spiral type of shape. And so that's the shape that we're going to be looking at in these guys. And one of the interesting things about this, the best way to actually see the spirochetes is actually with a a dark field microscopy, and so that works a little bit better to see it. And that's where basically the background is black and the bacteria is actually lit. And so normally we use light or bright field microscopes in the lab, and so that is where you have a really bright background, and then you use contrast with stains to stain the bacteria. What you see here in this picture, in picture B, is actually dark field, which is where the light is shining through the organism and the background is black. And you need a special filter on your microscopes to actually do something like that. So we won't be doing it in lab or anything, but I just want you to be aware that's one of the ways to really visualize a spirochete is using dark field microscopy. All right, so first group is Treponema. Here you can see a gram-negative stain, so they're gram-negative and they look like very long rods, but they're actually spirals. They live in the oral cavity, intestinal tract, and perigenital regions of humans and animals, and so you see them in different spots. The one we're going to be talking about the most is going to be the one found in the genital tract, because that's the one that causes syphilis. They are strict parasites that require complex growth mediums, and they require live cells for cultivation, so these are real tough. They're actually kind of in between what you would think of bacteria and a virus, because they really need a human host in order to survive. They don't grow well on plates. They don't grow well outside of culture. You need cell cultures and that. And that's some of the same requirements that you see with viruses. And when we talk about viruses in the next couple of lectures, you're going to see that viruses are really hard to manage, not only because of the size, but that you have to have live cells in order for these things to happen. Pretty much the same thing goes with Treponema. Now, the size isn't an issue, but keeping them alive and making sure that they're happy growing on cells, that's the big key in this situation. Okay, so Treponema pallidum is the one that causes syphilis. Here is the bacteria here. I like this. I'm going to drive you crazy, and I'll talk about that in a little bit, why syphilis wants to drive you crazy. A human is the natural host, and again, it's extremely fastidious and sensitive and cannot survive long outside the host. So this is one that's not going to survive on toilet seats or anything else like that. So the only way you're going to get it is direct human-to-human contact with fluids and open wounds or open mucous membranes and that stuff. It's sexually transmitted, and it can cross the placenta, so moms can pass it on to babies as well. Also, we see this as the delivery, that the mom can pass it, and that's one of the reasons why you give eye drops to babies when they are being born, so they don't risk getting syphilis in the eyes or anything at that time. Okay, so here you can see, here is the stages, symptoms, and diagnosis and control of syphilis. Now, syphilis can be divided into a number of different stages throughout its life cycle. And again, the first one is probably the most common, which most people think of, is that you have this incubation or infection where, again, you have no lesion, and it's kind of before you even know. So what happens is the person has sex or unprotected sex, and then about anywhere from a couple of days to 3 weeks happen where you have no incidents or any signs or symptoms that go on. And then you get into the primary stage where finally you have some kind of a lesion. And typically what you see is a chancre and open ulcer around the genitals. And so if you're talking female, this is going to be around the vulva or the vagina. And in the men, it's going to be on the penis or around the surrounding area. And then what happens is the chancre will heal, and then again there might be a little scarring left over, but then people think, oh, it went away, no problem. But then what happens is those guys can get into the blood, and then that can develop into what is called secondary syphilis, and you get more gradual or more symptomatic or systemic symptoms throughout the body. And again, this is now where the bacteria is actually in the blood. You can get a rash throughout the body, and I'll show you a picture of that. You can get some sores in the mouth, the nose, the eyes associated with this, and you can get a lot of other things that are associated. Then what happens is that then it goes into another latency period after a couple of weeks after the secondary. And again, if you don't treat it and you think, oh, it went away, number of years later, it can reappear, and the bacteria can actually go to the brain. And then what happens is that the bacteria goes into the brain, starts playing around with the neurons, screwing around with the neurons, and what happens is that the bacteria destroys those neurons, and then you develop into what is called syphilitic dementia. And essentially what happens is that because of the neurons and the destruction of the neurons in the brain, you have issues where, again, you get dementia, mental problems, memory behavioral issues, a lot of other things, and you could eventually slip into a coma and die from this. And again, this is if a long progression. If you don't treat it or you don't have any symptoms at certain stages, this thing can progress into what is known as tertiary or late disseminated stages of syphilis. And again, I'll show you some pictures about all these different stages, but that's typically what happens. And so you can see there is some treatments, how we diagnose it and that stuff, but really once it gets into the brain, there's not much you can do in those situations. It's going to be a long interesting road. And I'm sure there's probably, if some of you guys work in nursing homes and that, there's probably a few of those people that have dementia that is actually due to syphilis, not necessarily just old age or age onset dementia that's going on there. And again, you're not going to know unless you know the whole patient history in those situations. Okay, so that kind of gives you an idea about syphilis and what it can do. Now, again, the primary stage is right after the incubation, so after unprotected sex. This can be anywhere from 1 to 3 weeks after the infection. And what happens is that it binds to the epithelium, multiplies, and forms the chancre. And so you can see it's kind of an ulceration around the genitalia. And again, fluid from the chancre is highly contagious, and the chancre spontaneously heals as the spirochete moves in the blood. And this can occur anywhere from 3 to 90 days after initial contact. So it's a long window where these things or these symptoms or signs can actually show up. So in some people, it's asymptomatic where you don't have any signs or symptoms at all. And so you might not even get this at all and not even know that you're infected. But typically, we see a lot of these symptoms, very common to see this. And when you see this, go to them, get medical attention, and take the antibiotics that are prescribed to you, and I'll talk about that in a little bit. Now, the secondary, like I said, this is when the spirochete leaves the epithelia, and then what you can get is, again, more systemic types of infections because now the bacteria in the blood, you start to see a rash around the body. Again, you get headache and sore throat due to the immune response to the bacteria. You can get other sores or abscesses in other parts of the body. Here's one in the mouth. You can see on the lip or inside lip of this person, and this can occur anywhere from 2 to 16 weeks after the initial infection. Again, after the initial chancre, if you had that, or if you're asymptomatic, this may develop a few weeks to months down the road from this. Okay, again, if you let this go untreated, this can then develop into what we know as tertiary syphilis, which is long term, and I'll show you that. And again, this is left untreated, tertiary syphilis forms, and this shows you what the damage of syphilis can do to the brain. Here's one hemisphere, here's the other hemisphere, and you can see this is basically infected with the syphilis bacteria. It can damage multiple tissues and organs, can lead to neurological syphilis to the brain, which then again leads to dementia and other mental issues, behavioral issues, coma, other things that can occur. It can also lead to cardiovascular syphilis in the heart. This is actually an infection of the aorta. So you can see that you get this enlargement of the aorta. You can see you get endocarditis from the bacteria growing on the heart and around surrounding this. And this is all due to the syphilis bacteria. And this can be anywhere from 10 to 25 years after infection, sometimes even later. So again, these are not uncommon. And especially if you don't have any early symptoms and you don't know this is in you, you wouldn't suspect this unless they do some kind of serological testing of your blood. And so unless you are suspecting of it, the doctor will not look at this unless you ask them for these specific tests. And if you suspect that you may have this but not showing any symptoms, they can do an easy blood test to look for antibodies and then treat you for the disease. And so obviously you want to get it before it gets to the tertiary stage, because if it goes to here, there's very little they can do at this point when the damage is already done. Okay, so you want to be aware, and if your body's telling you something, you better listen to it. Okay, now congenital syphilis can pass through the placenta of the fetus, and so anytime we talk about congenital, that means it's affecting the child. And so in this situation, what happens is that the bacteria itself gets into the mom, gets into the bloodstream, and then can cross the placenta into the child. And again, we can see things like nasal discharge, skin eruptions, bone deformation, and nervous system abnormalities, depending on how serious it is. Here you can see the tooth abnormalities due to the syphilis. And so this kid was a congenital case where, again, the syphilis was passed from the mom to the child. And you can see that it misshaped these teeth. And so this is obviously a serious consequence. And then you can see this is one of the ramifications of congenital syphilis. Obviously, some things where you're talking about nasal discharge and skin eruptions are not as bad as having bone deformation and nervous system abnormalities. And so, obviously, if you're pregnant and that stuff, you should always get tested for STDs in case, if you were ever exposed. Those Some of these things can cross the placenta and cause problems. Also, during delivery, they will find out if you have any actively growing STDs at that time. And again, they may opt for a C-section or cesarean section versus a normal live or normal birth or normal delivery in that case because of the risk of these STDs passing on to the child. So it's all, again, medical history and that stuff that determines these different things. And so that kind of gives you an idea of the bacteria that causes syphilis. Okay, so diagnosis and testing, again, they can mimic other diseases. Again, some of these rashes and other things can mimic. But again, there are symptoms, history, microscopic and serological testing, including the VPR, VDRL, and the FTA antibodies. And so these are all different serological tests that can be run to detect for syphilis. Good thing about syphilis is that it is penicilliase. It doesn't contain the penicilliase enzyme, and so penicillin G works very well against it. So we do have some good drugs against it. Again, what we see, and you guys know now, looking at the epidemiology, if you did syphilis, you see that there are lots of cases, and so a lot of times you see reoccurring infections and that stuff. And the other problem is too is that some people are asymptomatic, and so they don't show signs, and so they don't get treatment, and so that's the other issue too, and so they don't even know they have this disease going on with them. Now, ooh, this is bad. The concept check. So I don't know why this did this, but we'll just go on and we'll skip this. But again, I'll try and read it to you guys and maybe you can think about it. So if a patient presents a spotted rash and a test positive for a VDRL test, the most likely diagnosis is what? Primary syphilis, secondary, tertiary, or congenital syphilis. So which stage of syphilis was the rash shown in? Okay, if you can't read it, it is B, secondary syphilis. And again, the secondary syphilis is the one that is associated with, again, the rash, the bacteria in the blood. Sometimes you get ulcers in other parts of the body, can affect other parts in that. And so if you said rash and secondary syphilis, you'd be correct. Excuse me. All right. Now, some other types of non-syphilitic treponemosis includes Bigel, which is Treponema pallidum, but it's a subspecies that causes deforming childhood infection of the mouth, nasal cavity, body, and hands. And so this is one that normally grows in the oral cavity of some people, and again can be spread through again kissing and other solution, or saliva and other types of body solutions and that passing around. Yaws is another one. This is invasion of a skin cut, causing a primary ulcer that seeds into a second crop of lesions, and again can be spread. And I think this down here is yaws, and so you can see skin lesions can cause an effect. And then the pinta is a superficial skin lesion that depigments and scars the skin. And again, you have more of these. It might be one of these two, but these are examples of the different types of non-syphilitic. So treponemia, again, associated with the endothelium and that stuff, and the endothelium is the skin and mucous membranes and that. And so those are the first effective, and then the bacteria break out, get into the blood, and can lead into other infections as well. Okay, so that's some other diseases, but primarily what I want you to focus in on is syphilis because that's a big thing here in the United States. Okay, now we'll get into Borrelia. Now, Borrelia, again, is a species that is a spirochete. Again, there are two of them that are real interesting. One that we really care about here in Wisconsin because we have a high incidence rate of Lyme disease here in Wisconsin and lots of these wonderful deer ticks that actually carry the bacteria. And so we'll talk about this. We'll also look at the Borrelia Hermsii, which causes the relapsing fever as well. So again, these are very large spirochetes with anywhere from 3 to 10 coils. Here again, gram negative showing you the staining. The Burgdorferi are transmitted by our arthropod vector. So again, Burgdorferi by certain ticks, and then the Hermsii by other ticks. And so we'll look at both of these, but think of the arachnids in this case, the ticks, I think one's soft body, one's hard body, and we'll look at that between the ticks and that stuff, and we'll take a look here in just a second. Okay, the Hermsii is called relapsing fever. Typically, it's found out west, and again, wild mammalian reservoirs, including squirrels and chipmunks, actually carry the disease. It's transmitted to you by getting bit by ticks. So if you go out west and go out hiking, not only can you get plague, but you can get this relapsing fever. And anywhere from 2 to 15 day incubation, patients have a high fever, shaking and chills, headache, and fatigue. Wow, it sounds a lot like the flu. Okay, and so these are flu-like symptoms and anywhere from 2 to 15 days. And what happens is that then you can get some nausea, vomiting, muscle aches, abdominal pain, extensive damage to liver, spleen, heart, kidneys, and cranial nerves if it continues. As the parasite changes the immune response, resulting in recurrent relapses. And again, there is tetracycline that's used for this. And these are typically the systems you see. You see a truncal rash, you see muscle aches. Sometimes you feel discomfort in the abdomen due to enlarged liver and spleen. Sometimes you'll get joint pain, shin pain, typically retroorbital around the eyes, and the headache associated with these things. And again, it's all about hiking and traveling out. If these are the things that you see, or the history of this, or this is what your patients have been experiencing, then you can kind of associate, oh, maybe it is a tick-borne infection. Now, what else is also in common is this relapsing fever. So you kind of go through these periods where you get these abnormally high temperatures, and they keep coming back and back and back. And remember, during the immunology, we talked about the primary and secondary response. Well, what happens is these guys can change over the course and change their structure so that the body doesn't recognize them again and again and again. So you keep getting what is known as this relapsing fever. And so that's why it's called the relapsing fever pattern or relapsing fever disease, because you keep getting these really high fevers every 6 to 7 days intermediate and associated with some of these other symptoms. And you can see that it can go on and on and on depending on how many times you get an antibody response. And finally, eventually you could clear, but you could cause a lot of organ damage at the same time. So if you're seeing this where you get a high fever, then it goes away, and a high fever, and then goes away in a matter of a couple of days, this is something you want to get checked out. This is not something you want to play around with. And again, associated if you've been out hiking or out camping or other things, especially out west in the western United States, this might be a sign that you have this relapsing fever and you may want to get tested for it, okay? And then get treated for it as well. Now, the other one that we're concerned with, especially here in the areas of the upper Midwest and then out east, is this Borrelia burgdorferi, and this is what causes Lyme disease. And so since our school is located here in Wisconsin, I know some of you guys are watching this in other places, but this is one of those that we really have a high intensity for, we have a high incidence rate for, and that's because we have lots of deer. Around Wisconsin, we have deer running around the suburbs and the neighborhoods, even in the city of Milwaukee, we have deer running around. And so they are wonderful carrying these wonderful deer ticks. These deer ticks can then bite during the summertime, and especially if you like hiking and camping here in the upper Midwest, you are more likely to get bit by one of these things and potentially get infected. Again, typically they're carried on field mice. Then the tick gets bit by that. We can be an accidental host, or it can get into the deer and get into the deer population. And this is a cycle that continues on. You can see the size of the ticks are actually very, very small. So you might not even know that you have them on you. And so one of those things that you should always do after you go camping or hiking is search and just look over to make sure you don't have any ticks on you or that you're carrying with you, because this could be something that you could get an infection from. And so it's not the tick so much that you worry about, it's the disease that it's passing on to you. So it bites you, it gives you the bacteria, that bacteria gets into your bloodstream, and then it leads to the infection. Okay, and again, it's acquired by tick bites, and you can see here the different sizes of the ticks. It's typically non-fatal. Not many people die from Lyme disease, but it's a slowly progressive syndrome that mimics neuromuscular and rheumatoid arthritis conditions. About 50 to 70% get this bullseye rash. So if you see this rash anywhere on your body, that means you've been bit by this tick and you have the Borrelia burgdorferi infection going on in you. So that is a telltale sign. If you see that, hey, I've got this rash, you need to go to the doctor. You may also suffer from fever, headache, stiff neck, and dizziness associated with this. And again, untreated, it can progress into cardiac and neurological symptoms. It can also go into polyarthritis, go to the joints. And so typically where we see this bacteria end up is in the joints, in the fingers, the arms, and the elbows, and on the legs. And so again, it's one of these things that can be pretty crippling over a long period of time. And so you may have heard of some famous people out there that have said, hey, I've gotten Lyme disease and it's been pretty nasty to me. It's, it's really made my lifestyle pretty awful and that stuff. It doesn't kill you, but it can be a slow degenerative type of disease where, again, you lose it can mimic a lot of neurological symptoms. And again, the joint pain associated with it can be overwhelming as well. Again, it can be treated with tetracycline or amoxicillin. If caught early, again, later on, it's more difficult to treat. So the earlier you can get to the doctor, you get it treated, especially if you see that rash, the better off you are in those situations. Okay. All right, so let's move on to the curviform bacteria. The curviform bacteria are the ones that have kind of the bent looking rod. So it's kind of the curvy bacteria in this case. And like I said, there are three that we're going to look at: Vibrio, Campylobacter, and then Helicobacter in these situations. Okay, so again, the curviform bacteria are gram-negative, and these generally cause enteric diseases. Vibrio and Campylobacter stay in the intestine. Both of them cause wonderful diarrhea associated with them, and typically having just clean water and replacement with fluids and electrolytes is the best treatment for these situations. Now, Helicobacter is an interesting one because it's more of a spirochete that's found in association with the stomach. And again, the way that they actually found this, the researcher that did it actually infected himself and realized and gave himself an ulcer. And now, again, research itself can give you an ulcer if you never know or have ever done research before in your life. You know, it can be like hitting your head against the wall, and that itself feels like can give you an ulcer. But on top of the ingesting some bacteria and giving it to yourself, hey, that's a good way to give yourself an ulcer. And so we see in about 80 to 90% of the cases of people that have ulcers also have this Helicobacter infection. So again, a very high proportion. So we think that there's a very good cause and effect relationship with those. And we'll talk a little bit more about Helicobacter here in a few minutes. All right, so Vibrio cholera. So this is again a comma-shaped bacteria that's ingested in food and water, and again typically infects the mucous barrier of the small intestine. It's non-invasive, but what it does is it releases enzymes that cause the electrolytes in the water to be released from the intestinal cells. So what happens is that all these things get pulled out. So you can see that these things go in and go to the blood vessel when you eat something. But in the case of when you have Vibrio cholera, it pulls the water along with the electrolytes back into the intestine. So you get this very, very heavy, aggressive, watery diarrhea that's associated with it. So this cholera toxin causes the electrolyte and water loss through secretory diarrhea, sometimes labeled as rice water stool, and the resulting dehydration leads to muscle, circulatory, and neurological symptoms. And so any of us know when you've been sick and you're sick and you're dehydrated, that leads to a lot of problems, and especially with muscle, circulatory, and neurological symptoms. So if you've been sick for a while, like how you can't even think straight, and again, circulation depends on having water and liquid in the blood, and even muscles can ache and get dehydrated, and it can be really bad. So the biggest key with cholera is, again, getting clean water, because where this comes from is by drinking dirty water. Where do we see this a lot of times? It's associated where you have natural disasters. So the last major cholera outbreak, now this is me quoting, is thinking about Haiti and the earthquakes down there, and that was a while back. So I'm sure there's been some newer ones lately that I don't know about cholera. But anytime you get dirty water mixing in with drinking water, you're always at risk of getting cholera infections. And again, typically the best thing you can do is get people clean water, get them rehydrated, and then treat them with some antibiotics. But even just the rehydration with the electrolytes is the key in keeping these people alive, because typically bacteria will pass eventually, but unfortunately what happens is that people die from dehydration before the bacteria completely passes through, or they keep re-inoculating because they keep drinking the same dirty water over and over and over again because they don't have clean water. So that's the key with Vibrio cholera. Okay, and again, biggest thing is rehydrate and treat with antibiotics. Okay, so again, This just kind of shows you what happens in the situation. So the bacteria gets in, and it gets in again either with contaminated food or water. Typically, where floodwaters or wastewaters are mixing with clean water, typically your natural disasters and that stuff, the bacteria get in. They release this toxin. The toxin then binds to the cells of the intestine, gets in, and causes a release of the electrolytes. Now, I'm not going to go in through all these different things, but basically, essentially, what it does is it forces the cells to basically just push all their electrolytes out along with the water into the intestine, which leads to watery diarrhea and then the loss of the electrolytes during that time. And so, again, due to these losses of electrolytes, that has an effect on neurological. So, you guys that have taken A&P and know about action potentials and that stuff, when you lose your electrolytes, that can have an effect on how muscles and nerves work. Again, the loss of water leading to dehydration can affect the nerves, and again, shrinking of the nerves, shrinking of the cells, and that stuff. And so that can cause a big problem. And so this thing is more about the loss of the water, loss of the electrolytes, than really the infection itself, because the bacteria, again, are relatively easy to get rid of and that stuff. It's due to just the rapid loss of water and electrolytes that causes the major problem with this disease. So getting clean water, rehydrate, and electrolytes back into these people is essential for survival. Okay. Now, some other Vibrio pathogens. Some are salt-tolerant inhabitants of coastal waters associated with marine invertebrates. Another one is the Vibrio hemolyticus, which is gastroenteritis from raw seafood. So you guys that like to eat raw oysters and that stuff, this could be an issue and give you a nice case of diarrhea associated with the raw oysters. You can get Vibrio vulnificus, which is gastroenteritis from raw oysters. There you go. Serious complications in persons with diabetes or liver disease. And again, anytime when you have an immune issue, in this case with diabetes, diabetes is just another thing with circulation and other things associated with blood sugar. And then liver disease, detoxification can cause serious problems. And again, in both of these situations, fluid and electrolyte replacement is important. Making sure these patients stay hydrated, and then finally the occasional antimicrobials to treat the infection if it is warranted in these situations. But typically, when you rehydrate and get electrolytes back into the patient, they feel a lot better, and then they finally pass the bacteria and they get better on their own. Okay, here's another concept check that again you can't read. I don't know what's going on with my slides today. I think I screwed something up when I changed the background, but sorry about this. But the main symptom of cholera infection is what? A rash, watery diarrhea, open lesions, or paralysis. So what is the most common symptom of cholera? If you said B, watery diarrhea, you are correct. And sorry for this slide. It's so funny. All right, so now the next group is Campylobacter, and the Campylobacter is a slender curve or spiral bacilli, often S-shaped or gull-wing pairs, so kind of that curved pairs. Has polar flagella on either end, and is a common resident of the intestinal tract. Can be found in the genitourinary tract and oral cavity of birds and mammals. And the two that we're going to look at is the Campylobacter jejuni and the Campylobacter fetus. And so these are the two that cause the most problems. The jejuni is typically the foodborne one. The fetus is one that can cross the placenta and again cause serious complications to the fetus. And so we'll look at that here pretty quickly. Okay, so Campylobacter jejuni is an important cause of bacterial gastroenteritis. It's transmitted by beverages and food, and so sometimes you'll hear about these outbreaks. Again, it reaches the last segment of the small intestine near the colon, will burrow through the mucus and multiply. There is a toxin that causes secretory diarrhea like cholera. And again, symptoms include headache, fever, abdominal pain. Sometimes you get some bloody or watery diarrhea because, again, it's a little bit more invasive than the cholera or the Vibrio in this case. And again, typically rehydration and electrolyte balance therapy is the key. And again, the person will normally pass this on their own. So if this is a diarrhea that's not going away and you've been suffering for a couple days, that's when you know this isn't just simple food poisoning. This is something a little more serious, and you need to get some treatment in that case. And again, anytime you can rehydrate, so Pedialyte is a good option when you're home by yourself, or when you're home and you just want to treat it and you got the diarrhea, or kids with diarrhea. Anytime to replace fluids and electrolytes, and hopefully it stays down. If it's not staying down, again, that's another time that you want to go see the doctor and find out what's going on. Okay. Now the other one is the Campylobacter fetus, and again, this is an opportunistic pathogen that infects debilitated persons or women in late pregnancy, and it can cause meningitis, pneumonia, and arthritis and septicemia in the newborn. So again, if you're pregnant, this is one of those infections that can pass through them. The intestine gets into the bloodstream and then crosses the placenta and can potentially have serious consequences for the fetus. So again, you have to be careful of undercooked food or contaminated water or beverages in this situation in these situations. So this again is another foodborne illness in these situations, but typically doesn't affect you unless you, or we see this really badly in pregnant women. So again, there's another situation. Okay, and then the last group of this curviform is the Helicobacter, and this is Helicobacter pylori. It's a gastric pathogen, meaning it stays in the stomach. And again, it's curved cells discovered in 1979 in stomach biopsied specimens. And again, people that suffered from ulcers, we found that there was a connection with this bacteria. And the researcher working on this figured this out by giving himself the bacteria. He swallowed it and gave himself an ulcer. And again, it causes about 90% of stomach and duodenal ulcers, meaning the upper segment of the small intestine. And the apparent co-infector was stomach cancer. So again, in people that have stomach cancer in that, we also see a risk of Helicobacter in those situations. Now, people with type O blood have a 1.5 to 2% higher rate of ulcers. Not sure why that is. Not sure if it has something to do with the antibodies. Obviously, it has something to do with antibodies in the blood, but I don't know the reason why that is. But the key factor in this guy, in the Helicobacter, is the enzyme urease. And what they do is they release this urease to break down uric acid or uric acid and then also urea to raise the pH of the stomach. So these guys can actually survive in a higher pH, and they raise the pH of the stomach, so your stomach acid's not really at a pH, or your stomach environment's not really at a pH of 1 or 2, but more like a 3, 4, or 5. And that allows for these guys to survive. And then again, they burrow into the stomach, into the lining, and you can see here's a normal stomach or upper small intestine. Here is one that's infected with the H. pylori. So you can see that you have these abscesses or ulcers that are actually forming in the tissue of either the stomach or the upper small intestine. So again, very common cause of ulcers, 90% also associated with stomach cancer. So again, this is one of those guys, if you have an ulcer, it's probably due to this guy. And so you might want to go to the doctor, go to a GI doctor and get it treated. And again, treat it with antibiotics to get rid of the thing to help you heal the ulcer that you may have. Okay. Now we're going to spend a few minutes on the unique morphology bacteria, one of those being Chlamydia. And again, Chlamydia is kind of interesting because it's kind of more like a eukaryotic pathogen or parasite in these situations. And it has two stages. It has one that's the infecting body, and the other one that is kind of one that is due for reproduction. And we'll look at these as well. So Chlamydia is an interesting one. Again, another wonderful STD that we hear and talk about so much, and again, causes lots and lots of cases. All right, so again, the medically important bacteria of unique morphology, it's unrelated to each other, but similar in morphology, pathogenicity in all types, or in all are atypical. And again, the two that we're going to look at is the Rickettsia, which causes rickettsia or Rocky Mountain spotted fever, and the other one is Chlamydiaceae, which is again an intercellular that goes from elementary to reticulate bodies. And again, one is an infecting body, the other one is a reproducing body. So we'll look at that. So it has two stages of the life cycle. The Rickettsia is typically found, again, tick-based, and so we'll see how these infect and cause this disease, but we'll talk about that as well here in just a few minutes. Okay, so the Rickettsia genus, again, is a small obligate intracellular parasite. It has a gram-negative cell wall. It's non-motile, but it has pleomorphic rods or coccobacilli, and it's carried by ticks, fleas, and lice are involved in their life cycle. And again, it enters into endothelial cells, causing necrosis of the vascular lining, can lead to vasculitis, vascular leakage, and thrombosis. So again, it's more typical seen into the blood, gets into the blood, and can lead to damage of the blood vessels. And so that's where we see it. Here's the bacteria itself, and you can see it's more of a round shape. It kind of looks more like a parasite, a eukaryotic parasite, than it does actually a bacteria. And we'll talk a little bit more about that here in a minute. Now, there are some specific diseases or Rickettsioses that are out there. So we have the epidemic typhus, which is by this Prowazaki, which is carried by lice, and it can cause high fever, chills, and headache. And again, it can be a chronic recurrent form. You can have the endemic typhus, which is the R. typhi, and again, it's harbored by mice and rats, and again, sporadically in areas of high flea infestation. They're milder symptoms than what you would see here. The Rocky Mountain spotted fever is caused by Rickettsiae, and again, this is a zoonosis carried by dog and wood ticks. It causes most cases in the southeast and the eastern seaboard, and again, a spotted rash may damage the heart and central nervous system, so that's where we see this the most. Again, passed by ticks. So if you go out hiking and doing those things, that's where you can see this infection. And again, Urrelia is another one that contains two species of Rickettsia. They're tick-borne, causes human monocytic and granulocytic urticiosis. Okay, and so we're seeing more cases of that as well. Now, here are again some of the diseases that are caused by these guys, and again, the organisms that do it. In my class, I'm not going to ask much about these. I think more about the different vectors and that stuff. We're going to look at that, especially in the next chapter when we get into, or in 2 chapters from now, in chapter 23, when we talk about parasites and how those all work and that stuff. And we'll talk about the ectoparasites, which are, again, these vectors and where they go. And again, most of the time we're seeing humans get it, and get it from tick bites or lice bites or flea bites in this situation. Okay. Again, Rocky Mountain spotted fever is caused by Rickettsiae, and again, it's transmitted to humans through a tick bite. And again, it's most common rickettsial infection in North America. You can see where it is, and then the highest numbers are in the southeast and on the east side of the United States. And again, typically it's carried by dog ticks. Those dog ticks, the tick will again, sometimes will be the incidental host will be biting humans, release the bacteria, and it can cause central nervous damage, coma, the spotted rash that's associated with it, and it can lead to vascular damage as well. So these are a couple of things that you can see associated with the Rocky Mountain spotted fever. Okay. Now again, the first symptoms are fever, chills, headache, and a spotted rash that appears. And again, this will be all over the body. The central nervous system can become involved, and fatality rates are about 20% if left untreated. And so again, if you're seeing rashes and things like this is time to go to the doctor and say, hey, I've got something going on. I think I got bit by a tick, and now I have some of this disease. And again, doing the testing, serological testing, they can look for the pathogen in the blood and then treat you with certain antibiotics. Okay. Again, here's the concept checked. Again, I should just skip these things, but I'll make you suffer through and look at these things. The organism that causes Rocky Mountain spotted fever is found in blank and transmitted by blank. And so is it mice and ticks, rodents and fleas, canines and urine, humans and lice? Where do we see it? And what is it transmitted by? So in this case, Rocky Mountain spotted fever is found in mice, and it's transmitted by ticks. Okay, and so there you go. Good job if you got it right. All right, so let's look at chlamydia, and then we'll move on to dental disease after that. Now, chlamydia, again, is an interesting pathogen because, again, it kind of takes more of a shape of a eukaryotic parasite. So it kind of doesn't look like the normal bacterial pathogen that you see. And what you see in here is that it forms two different bodies inside the cells. And so what happens, these are small gram-negative obligate intracellular parasites. They actually get inside the macrophages and neutrophils and multiply in there. And so what happens is that it goes in between this elementary body and reticulate body. One is infectious, and so the elementary body is the infectious form that goes in and gets eaten up by these cells, and then it forms into this reticulate body, which then divides inside the cell. And so I kind of call this the reproducing one, because the elementary body is the one that infects the cell. The reticulate body is the one that reproduces inside the cell. And you can kind of see here, you have the two different forms inside the phagosome. You have the elementary body, which has gotten into the cell, and then you have this reticulate form, which is now actively reproducing. And you can kind of see here, as it gets in, it goes through these different things. So the one is the infection of the host cell, gets in, changes from the elementary body into the reticulate body, which then reproduces into a number of these reticulate bodies, which then turn back into elementary bodies, leave the host cell, and then go to a new host cell. And that's how the infection takes place. Okay, so again, humans are the reservoir, and two strains can infect humans. There's the trachoma, which attacks the mucous membranes of the eyes and the genital urinary tract and lungs. Okay, and you get ocular trachoma, which again causes severe infection, deforms the eyelid, cornea, and may cause blindness. So you can see it here in this infection. You can get inclusion conjunctivitis, which occurs in babies as they pass through the birth canal. And again, that's what those eye drops are for. So if mom doesn't know that she has chlamydia, they can treat the baby with the eye drops. And again, they typically use eye drops as soon as delivery to make sure that nothing gets into the eyes, any infections in the eye. And again, it can cause an STD, which is the second most prevalent STD next to herpes, and leading to urethritis, cervicitis, splingitis, and PID, infertility, and scarring. And again, all the infections get into the uterus, can get into the fallopian tubes, lead to scarring and blocking the tubes. And so that's where, again, can lead to these infertility issues. And again, typically you see these little round bulges around the area of the genitalia and that in the skin. It is again, typically in the epidermal area and then gets into deeper tissues as time goes on. Okay. Again, another thing, again, two strains that can affect the trachoma, attacks the lungs, member, and the eye. I think we already talked about that. And another one that is out there is this lymphogramuloma venereum, which is a disfiguring disease of the external genitalia and the pelvic lymphatics. And remember, there's a lot of lymph nodes in the pelvis, and so these cause the pelvis to swell, and you get these necrotic or very large lesions of the lymph nodes in the groin and genital area, and so that can lead to these types of infections and scarring in those cases. Okay, another one is this Chlamydiophilia, which is a new genus. Used to be members of the Chlamydia, and the Chlamydia pneumoniae causes atypical pneumonia, but it can be serious in asthma patients. And the Spirochetes causes ornithosis, a zoonosis transmitted to humans by birds. It's highly communicable among all birds, pneumonia or flu-like infection with fever, lung, and congestion. And again, it's more opportunistic in humans where you got a weakened immune system, and we can see this chlamydiophilia, cetacea, I think it is. So again, another one that we see. All right, so the last part we're going to talk about today is the dental disease and what's the difference between healthy and unhealthy gums. So let's take a look. And so obviously we got nice healthy gums here versus unhealthy, the red, receding gums and that stuff, which are unhealthy. And this is all due to the bacteria we harbor on our teeth. And if we don't take care of our teeth, we end up with situations there on the right. Okay, so bacteria in dental disease, again, the oral cavity is a complex, dynamic ecosystem containing 400 species of bacteria, and dental disease goes in progression. And so, again, we typically get bacteria on our teeth. We have lots of bacteria in our mouth, they land on our teeth. Depending on how much sugar we eat every day, the more sugar we eat, the more food we give to those bacteria to eat and grow on our teeth. You get this pellicle formation, which is essentially the sliminess that grows on your teeth. That can lead to plaque formation, which is the harder calcification that forms on your teeth, or the yellowing on the teeth. And this can lead to the calculus, which is the tartar formation. You can get gingivitis, which if it gets underneath the gum line can cause activation and inflammation of the gum line, which can then lead to bone reabsorption. You can see here calculus and caries on the teeth that can actually cause the gums to recede in between the teeth. Once the gums recede and the bone recedes from the teeth, now you can get tooth loss because they become loose and the teeth fall out. Another way this can happen is due to plaque formation. The bacteria produces acid by fermentation of the carbohydrates on your teeth, which then wears away at the enamel, causing the dental caries, damage to the enamel, and then tooth destruction from the inside out. And so it can happen in one or two ways, either on the surface of the tooth itself due to the acidification and cavication of the bacteria in this case, or it can happen underneath in the gums, the inflammation of the gums, which leads to bone reabsorption and then loss of tooth. In both situations, if they're not taken care of, the teeth will have to either be removed or they will be lost in a matter of time due to the destruction of the surrounding tissue. Okay, so how does caries actually form? How do we get this? And so again, we have our wonderful bacteria here, along with all the yummy goodies we like to eat every day and not brush our teeth. Those are food for the bacteria, which then again secretes acid. So again, through the carbohydrate fermentation, produces lactic acid and other types of acids, which then sit on our teeth. Those acids wear away at our enamel and cause again destruction of our teeth. Now, you can do a couple of different things where again, with mineralization of the water, so adding fluoride to the water can actually cause a remineralization to promote stronger teeth, and again, get sugar intake, lower the sugar intake, proper plaque removal, fluoride, and calcium phosphate will remineralize and strengthen the enamel. Whereas if you have poor salivary function, prolonged and frequent in sugar intake, and poor plaque removal, poor dental care, you get serious tooth loss in this situation. Now, what happens in these situations? So again, begins with the slime-forming species of strep and actinomyces. Both grow and make these wonderful biofilms on your teeth. That's the sliminess that you feel on your teeth. You don't brush your teeth for a while, you start to form these thicker layers of adherent material known as plaque that harbors masses of bacteria which produce acid that dissolves the enamel. Again, this is the acidification. Then if plaque is allowed to stay, other invaders come in. So if you don't get your teeth properly cleaned, so if you put off going to the dentist a couple of years, you can do a lot of damage to your teeth, and again allows other bacteria to come in. Acid continues to dissolve the tooth, leading to caries, tooth damage, and then now you're going to need fillings and crowns and everything in between. So it can cause a lot of problems if you don't take care of your teeth. Okay, here shows you the wonderful variation of bacteria that kind of shows you the process of what happens. First, the strep come in, lay down and bind onto the wonderful things that are on your teeth, the different sugars and carbohydrates that are there, starts to form the wonderful slimy layer, the pellicle layers on there. And then you get other bacteria that start to grow on that forms the tartar and the calculus. Those things form on there. That's the hard yellow stuff that you have to get scraped off your teeth. Once more and more bacteria come to the spot, they start producing lots of different materials, breaking down the carbohydrates that are there, and then you get acid, which then starts breaking down the tooth enamel and everything in between. And so that's what happens in these situations. So you get damage to the enamel, and eventually it leads to caries and other things. So here you can see the enamel itself is getting worn away and damage is occurring due to the bacteria, the over excess of bacteria. So cleaning your teeth all the time, and again, you dental hygienists should be the ones standing up and saying, yes, you need to go get your teeth cleaned and take care of your teeth so you don't end up with situations like this. Okay, now what happens in periodontal disease? That's the infection of the gum line in that. And so what happens, it's a soft tissue disease, and this is when plaque gets calcified, the calculus above and below the gingiva, which is the gum line. And so what happens is the first thing you see is inflammation. And so that's why your hygienist will go and poke at your gums to see how healthy and how well they respond. If they poke them and they start to bleed, and they don't have good spring back to them, that's the early signs of gingivitis, which means you have inflammation going on and you may have bloody gums, and it's associated too with bacterial infections underneath the gum line. And so pockets between the tooth and gingiva are invaded by bacteria. The tooth socket may be involved. This leads to periodontitis, and then eventually the bacteria or the tooth may be lost due to these situations. So obviously this is a bad situation. You can see the gums have receded, you have bone reabsorption, you have loose teeth in the situation, they might fall out eventually or might come out in your meal and that stuff because they break off and that's obviously a bad situation. You never want to get your teeth to this situation. So if you see bleeding gums, this is a good sign you need to go to the dentist and get something done and get a cleaning and maybe further go into more advanced care and doing a little bit more than what you've done in the past. Okay, so how can we repair dental disease? Well, one of it is to stop the infection. So in any of these cases, this is an infection, and there are a couple of different ways to go about cleaning up the infection. One is scaling and root planing, which again, scraping the tartar off above and below the gum line. So this is a little bit more going in and around the gum line, trying to remove the tartar. Planing is basically getting rid of the rough spots on the tooth root. So again, not aggravating the gingiva and actually calming down the inflammation. Sometimes you might get medications associated with this, an antibiotic rinse, antibiotic gel, or oral antibiotics to get rid of the infection. And then finally, there are some surgical treatments that can be done to either get underneath to clear the infection, and again removing the gum back so that they can get down and clean this out. So this is known as flap surgery, where they remove part of the gum to get back in there and then they'll reattach it. Or what they'll do is a bone graft, taking it from other parts of the jaw and putting it in, or maybe some other part of the body and put it in to stimulate new growth. And so obviously these are a little bit more invasive. You really want to catch the problem early on. So if you let your teeth go for a while, you may be setting yourself up for this, or you're just going to get all your teeth pulled and you're going to wear dentures for the rest of your life. So this is one of those things that you need to really take care of your teeth. I know it's easy for us to say as adults, but when you're kids, a lot of times you avoid brushing your teeth. So starting good habits early on is really the way to keep your teeth looking healthy and being good. Okay, so that's going to help. Now, other diseases that are caused from dental disease, so it's not just a tooth issue here and that it can cause a bad night of eating, but it can also lead to other infections. And so, again, when you have bloody gums, that's a perfect way for bacteria to get into the bloodstream and cause bacteremia, which is bacteria in the blood. Again, we've talked about this before, cardiovascular disease associated with tooth or dental disease. So that is, again, a primary infection leading to a secondary infection around the heart. Can cause endocarditis, which is an inflammation of the lining of the heart or the valves of the heart itself due to the infection. And again, bacteria getting into the bloody gums can cause bacterial pneumonia because those bacteria in the mouth, again, anaerobic bacteria, the oral cavity, can move into the lungs because now you've set up an environment that they can go in there. And again, one of the real interesting ones is diabetes, because even though it's not a direct effect, and it's not an issue so much with dental disease, we do see a direct correlation in people that have bad oral hygiene are also associated with diabetes. And when you have diabetes, you have typically bad oral hygiene, and that's because of circulation issues and can complicate the dental condition. Again, diabetes plays a huge role in affecting a lot of different things around the body, and one of those is tooth health. And so we do see an interesting dynamic between tooth health and diabetes in this situation. So it's another situation where you want to take care of yourself in those situations as well. Okay, so again, the proper care for teeth, brushing and flossing limits the bacterial growth on the teeth, and it gets in between the teeth where the bacteria hide. I know your dentist always says, are you flossing? And they know when you have and when you haven't and that stuff. So if you're flossing every day, you know, it's a really good idea. Even if you floss once a day, it's better than none and that stuff. Drinking fluoride water. So if you have well water at home, and you're not getting city water, so fluoride, you might want to get some fluoride rinse associated with that to help you strengthen your teeth. It does reduce the mineral loss and it prevents bacteria from making acid. And so that's one of the things. So again, most municipalities have this. There are a few places that don't, but most places do fluorinate their water. And they find that it does a very good job and keeps teeth very healthy. Again, always avoiding sugary and acidy food to fuel bacteria in your mouth. That's always a common thing that you want to do. And then regular visits to the dentist so you get wonderful checkups. And again, other complications, cardiovascular issues, going to the doctor and making sure that, again, all these things are taken care of in a timely basis. Okay? All right. So a concept check. A biofilm found on the tooth surface that is made of multiple species is called what? Caries, calculus, plaque, or periodontis. Okay, if you said C, plaque, you would be correct. And plaque is, again, a combination of a number of different bacteria that are growing on the teeth. This is a little bit more than just the sliminess that you feel on the teeth. This is that yellow tartar, and that the plaque is the combination of multiple bacteria strains growing on your teeth, leading to acid damage and eventually to caries and tooth loss if untreated. Okay, so we made it to the end. To summarize, we looked at the spirochete bacteria. This included the Treponema, which was the syphilis, and the Borrelia burgdorferi, which was the Lyme disease. And so those are the two that I want you to know out of the spirochetes. Again, syphilis and Lyme disease, and just knowing some basic facts about them. You don't have to know all the signs and symptoms, but just some basic ideas. What causes Borrelia? What is the disease called? What is a common symptom of Lyme disease, which is the bullseye rash? With syphilis, again, knowing the primary, secondary, and tertiary phases of syphilis, I think are important. Those are good questions to ask on a test, and getting associated with the treponema with that. With the curviform bacteria, Vibrio, Campylobacter, Helicobacter, knowing where those guys infect, I think, is important. So Vibrio and Campylobacter are both in the small intestine, leading to watery diarrhea. Campylobacter is a little bit more invasive, and again, typically, treatment with those two is rehydration and electrolyte replacement. Helicobacter is the infection of the stomach. We see ulcers with that, the urease and that stuff. And again, stomach and small intestine ulcers, also an increased risk of stomach cancer associated with Helicobacter. And then you have the unique morphology bacteria, Rickettsia. And again, tick-borne, that's fine. I don't ask much about Rickettsia in there, but the Rocky Mountain spotted fever. Chlamydia is a little bit more, again, just knowing the common STD in this situation, along with treponema, the syphilis, and knowing a little bit about that. And then finally, the dental disease. We talked a little bit about what causes dental disease. Why do cavities form? It's due to the acidification, eating sugary foods and providing acids. And so you guys now are knowing, once we're doing these biochemical tests, you're going to start seeing fermentation of sugars and acids produced. And so think about your teeth in those situations. And periodontal disease, which is the inflammation of the gums and the teeth and the soft tissues surrounding it. What causes that? And again, that's the buildup of the bacteria growing under the gum line, leading to bloody gums and essentially infection of the gums, and could lead to tooth loss in both of those situations. Okay, so we made it to the end. I hope you got something out of this. Again, hopefully it wasn't too crazy or boring. Sorry about the questions and that stuff. Hopefully you could manage to that, and if not, maybe just fast forward through those, and that's fine. If you have any questions, please feel free to email me. Email me, send me comments, stop by my office hours, whatever you need to do in those cases. I'm always available for you guys out there to ask any questions and know a little bit more about these diseases. I thank you for watching, and I'll see you next time.